Hello, this is Dr. Gay from First Lake MRI. And this is just a normal patient showing the three fat pads of the anterior knee. Over here on the left is the kneecap, the patella. The quadriceps tendon comes down here, attaches to the top of the kneecap. The patellar tendon comes down here along the bottom. You see the femur, this big thigh bone here. And you see the tibia down below. So these are all the boundaries. And in the very front of the femur, there's the prefemoral fat pad here, this vertical band. Almost never see anything wrong with the prefemoral fat pad, so you can almost just disregard it. But there's a little triangle right here called the quadriceps fat pad. The quadriceps tendon comes down here, attaches on top, and this is a little fatty triangle. Usually it's about the same signal as the surrounding fat, but you can see it right here. And sometimes it can get inflamed and swollen. Down here is called the Hoffa's fat pad. Hoffa's fat pad sometimes will have fluid in it. It can be inflamed. It can be injured. So we're going to look at one example of inflammation up here. But first a test. This is just another random patient here. We're going to look at these same fat pads. Now this patient, they're not as easily seen, but you can see some fatty signal here in the front prefemoral fat. The quadriceps fat pad looks smaller in this patient, maybe here, but it's definitely not expanded. It's not really that bright. This is the Hoffa's fat pad. You can see a little linear band of brightness here, or I'm sorry, low signal. This little band is in the region of the infrapatellar ligament or ligamentum mucosum. You can get a linear band that comes down here like this. So that's no big deal. So this is really essentially normal. Now we're going to look at one that is not normal. And this is the quadriceps fat pad up here. Instead of being fatty like the prefemoral fat, Hoffa's fat pad, look how gray and foggy it is. It looks a little plump too, like it's expanded. This is what we call quadriceps fat pad impingement. On this one, this is sensitive for fluid, and you can see this is fluid, so it's inflamed edematous. This patient had anterior knee pain related to quadriceps fat pad impingement, just abnormal mechanics of stress. Pinch it, supposedly. It gets inflamed and enlarged and can cause pain, and that's it.